Participants were seated and heart rate, blood pressure, and finger temperature were measured as well as self-rate their level of stress. Blood samples were also collected. Clients were seated comfortably with a blanket and they were asked to close their eyes while the lights were dimmed. Blood was drawn again after 15 minutes and after 30 minutes, they were asked to rate their stress level. Scores were obtained after a 20-minute washout, where the participants walked around and talked about leisure activities and interests with the researcher. The chair test involved 30 minutes of sitting, while physiological indexes and self-rated stress scores were rated at 0, 15, and 30 minutes. The study used quantitative data in order to analyze an experimental study. Inclusion criteria of the participants included the following: normal hearing without hearing aid, being an employed full-time nurse for less than a year, between 20 to 40 years of age, a VAS 0 to 10 stress score of greater than or equal to 6, and between 45 and 70 kilograms of weight. Exclusion criteria included those with current or past abnormalities in endocrinology or metabolism, pregnancy, chronic organic disease, medicine, alcohol or tobacco use, those who experienced a major stressful event in the past 6 months based on the social readjustment rating scale, and those receiving physical training. The sample size computed for the study was to be 27, and the study used purposive sampling in obtaining the participants. This study revealed that participants listening to preferred music for 30 minutes experienced significant changes to their level of self-perceived stress score and autonomic responses. Results also showed that the participants preferred music with piano the most, followed by slow jazz and music with a harp, while Chinese orchestra was less appreciated. This study also showed that listening to soothing music can have a stress-relieving effect within a short period of time in highly stressed workers, such as newly employed nurses. It also showed that chair rest has beneficial effects on stress reduction, including biochemical marker profiles and self-perceived stress. Positive aspects regarding the participants of this study included them using purposive sampling, having no dropouts, the alpha set at 0.05, and the participants not being homogeneous at baseline. However, the sample size was insufficient. The participants also applied on a voluntary basis and had higher work-related stress levels. This meant a higher risk of dropout. Positive aspects regarding the methods of this study included it having a temporary effect in the treatment of stable chronic conditions, randomization on the assignment of the groups, conducting the test at the end of workday where there is high levels of cortisol, and using proper outcome measures in order to measure the outcomes of the study. However, due to insufficiency of the participants, a 15-minute interval was adopted, which was not as accurate as continuous measures. Restricted only to short-term outcomes in chronic diseases or processes, and the treatment does not permanently alter the disease well. Positive regarding the test statistics include it being a paired analysis and an intention to set analysis. However, the wrong test statistic was used, and the ITT does not accurately assess the treatment efficacy unless there is a protocol violation. The study gave us a cheap alternative to reduce the stress of the client significantly, and it showed music therapy is effective in reducing stress in high-stress workers. It was also able to demonstrate the effect of soothing music on the biochemical markers of stress and self-perceived stress. Although the study is good and the results may be beneficial, due to the wrong usage of test statistic, we would not recommend this study and the intervention for future practice. The test statistic has a great effect on the conclusion of the study, and knowing that the test statistic is wrong, then the conclusion drawn from the study cannot be deemed as accurate. Although the idea of the study would be beneficial to the practice, its inconsistency limits it from being applied.